Can the brain heal itself after a stroke? A person who suddenly loses the ability to walk, speak, or move their hand can sometimes recover those abilities again. But how does that happen? The answer is something incredible called neuroplasticity. That means the brain's ability to rewire, reorganize, and create new pathways after damage. In this video, we will understand what happens to the brain during a stroke, how recovery actually happens, what neuroplasticity means in a simple language, why therapy and repetitions are also important, and what stroke survivors can do to improve the recovery. If you or your family member is recovering after stroke, this video can help you understand the science behind healing. A stroke happens when a blood supply to the part of the brain suddenly stops. There are mainly two types. One is ischemic stroke caused by blockage. Second is hemorrhagic stroke caused by bleeding. Brain cells need oxygen continuously. But when the blood flow stops, brain cell begins to die within few minutes. Now here's something very important. Different parts of the brain control different functions. One area controls movement, another controls speech, and the next another controls balance. Still another controls memory. So depending on which part gets damaged, symptoms can vary. Weakness on one side, facial drooping, difficulty speaking, balance problems, memory issues. Earlier, people believed that once brain cells die, recovery is impossible. But modern neuroscience proved something revolutionary. The brain is not fixed. It can adapt, it can reorganize, and it can create new pathways. This ability is called neuroplasticity. Now, just imagine a road in a city is blocked. Traffic doesn't stop forever. Cars find alternate routes. The brain works similarly. When one pathway is damaged after a stroke, the brain tries to create new connections to bypass the damaged area. For example, if the stroke damages the area controlling hand movement, nearby healthy brain cells may slowly learn to take over that function. This is why rehabilitation exercises start working. Every repetition tells the brain this movement is important. Build this pathway again. Immediately after stroke, the brain becomes swollen and inflamed. As swelling decreases over days and weeks, some functions naturally improve. Some brain cells are not dead, they are temporarily inactive or stunned. With proper blood flow and recovery, these cells may start functioning again. This is the most important stage. Now, the healthy neurons start making new connections. The brain literally starts rewiring itself. Now, every exercise, every attempt to move, every speech practice sessions helps strengthen these new pathways. Sometimes another part of the brain learns to perform the lost function. This is why consistent therapy is so powerful. One exercise done once will not change the brain. Recovery requires repetition again and again and again because repetition strengthens neural pathways. Think of it like walking through the grass. One walk creates a weak trail. Hundreds of walks creates a clear path. The brain works the same way. This is why therapists repeat hand exercises, walking training, balance practice, speech drills, functional activities. The more meaningful repetition the brain receives, the stronger the rewiring becomes. Now, the brain is most adaptable in early weeks and months after the stroke. This period is often called window of recovery. That doesn't mean recovery stops later. Improvement can continue even years after stroke, but early rehabilitation helps maximize neuroplasticity. Now, let us understand the important therapies included in this entire rehabilitation. The most important therapy is physical rehabilitation through occupational therapy, speech therapy, cognitive rehabilitation. Now, as an occupational therapist, I always tell patients recovery is not only about muscle strengthening or not just a physical rehabilitation, it is about retraining the brain. Now, regular therapy stimulates the brain daily. Keep practicing in a real life task helps more than random movements. For example, buttoning a shirt, holding a spoon, standing from a chair, writing, brushing the teeth, these helps. The brain responds better when the patient is actively focused. Sleep helps the brain consolidate learning and healing process. Every movement improves blood circulation and stimulates the brain. Keep encouraging. This encouragement helps improve motivation and consistency. If the affected hand or leg is never used, the brain receives fewer signals to rebuild the pathways. Mental health also plays a major role in the stroke recovery. These can reduce brain healing and increase risk of another stroke. Sometimes patients stop trying because movement is difficult, but avoiding the affected side can reduce recovery potential. Recovery stops after 6 months. Is it true? No, it's absolutely false. The brain continues adapting for years. Older patients cannot recover? No, that's false. Recovery is possible at any age. If movement hasn't returned quickly, it never will. That's the false. Some patients improve slowly over a long period. Stroke recovery is not linear. Some days feel encouraging, some days feel frustrating, but every small effort matters. Every attempt to move the hand, every step, every spoken word is helping the brain start rebuilding. Neuroplasticity gives you hope. The brain is always learning. If you found this video helpful, share it with the stroke survivors and caregivers because understanding recovery can improve motivation and rehabilitation outcomes. Comment below what topic should I explain next? Hand recovery after stroke, balance training, speech recovery, spasticity, brain exercise after stroke, and don't forget to like, share, and subscribe for more evidence based rehabilitation and health videos. Thank you.